Thank you, Chair. So the report today is coming to committee as part of the consultation approved by Cabinet on the 9th of February. And the consultation concerns the proposed closure of Hamilton Court residential care home in Colville, Smith Crescent short breaks service in Colville, and the potential reconfiguration of 2 units at the Trees site in Hinckley from long stay accommodation to short breaks. The buildings concerned, starting with those buildings in Colville. Hamilton Court is a residential care facility for people with learning disabilities. It has the potential to care for up to 7 adults with a learning disability, although currently there are only 4 residents. The accommodation is offered over 2 floors. It's not a purpose-built accommodation, and there are significant issues with the design and layout of the property, not least of which that it doesn't have any lift to the first floor, which makes accessibility difficult. The site at the Trees, known as Beechwood and Ashwood units, are purpose-built single-storey accommodation for up to 9 adults with learning disabilities, mental health conditions and physical disabilities. There are currently 7 residents. The Trees itself, the building at the Trees, although purpose-built, does also have some accessibility issues and some design problems, and together with some health and safety issues which would need to be rectified, particularly structural issues to do with the atrium, as well as issues with accessibility in terms of door widths, door frames, and the ability of staff to use equipment due to the room sizes. The building at Smith Crescent is a short breaks facility which caters for up to 6 people at any one time, and there are currently up to 30 families that use the building in the service. Again, it's not purpose-built accommodation, it's a conversion of semi-detached buildings. It has communal areas and it has bedrooms on the ground floor and first floor. But due to its design, the occupancy at Smith Crescent has been 38%, as opposed to over 70% at the council's other short break services. So the fact that the building is not suitable for purpose is limiting its ability to take people on short breaks and respite care. Across the county there are over 360 people in residential care. The county council provides 11 people with care across the 2 units that we've discussed, and they are the only residential care facilities that the county council provides. So the vast majority of people within the county receive their residential care services through the independent and private sector and voluntary and private sectors. And we believe that there is sufficient residential accommodation available in the county should the proposals be agreed by Cabinet. Clearly, before any determination was made in terms of the future accommodation and care requirements for the people who are resident in the buildings, we would undertake individual reviews and full assessments of the individuals concerned. We'd have a look at what their current care needs were, what their current accommodation needs would be, what their future care needs are likely to be. We'd discuss transition arrangements and also any particular issues that people may have around important relationships. We can't undertake that work until such time as the proposal has been considered by the County Council's Cabinet, because to do so would be to prejudge the outcome of that consultation. However, we have committed to ensure that no buildings would close and no services would be changed until that work had taken place and until we had agreed with families and with individuals an agreed future care plan for each person. This is a difficult consultation. I have to say we are aware of the challenging nature of the consultation. We're aware of the difficulties it places on individuals and on their families. We don't undertake the consultation lightly. We have met with each of the families. We are continuing to meet with families throughout the consultation. We have individual meetings arranged with people who've asked for those meetings, with both myself and with a Cabinet member. And we will consider all of the responses that we get throughout the consultation, including the committee's response today, before we put forward any further proposals, any final proposals to Cabinet in June or July of this year. We understand the difficult nature of it, and we understand the impact that it can have on individuals. So the closure of a care home is a sensitive issue. It's a difficult issue, but it's one that we put forward because we believe it to be in the best interests of both the individuals concerned and the County Council. We need to ensure that we have provision available not just for the 11 residents that we are currently providing care for, but also for the future generations of people with disabilities within the county. We know that over the course of the last few years, and it's our intent over the course of the next few years, to provide more care in supported living and in the community and in independent accommodation, and less care within residential services. We also know that there's an increased need for respite care within the county and for short breaks accommodation. And whilst we have developed purpose-built and what might be termed state-of-the-art accommodation in certain areas of the county, we don't have that across the whole of the county, and certainly Hinckley is one of the areas where there is a concern that there is insufficient short breaks accommodation to support families. And we need to make provision for that going forward. And the independent and private sector are not of a view that residential respite care is an area that they want to move into. So we have tested the market, and there are very few providers who will provide short breaks, respite care, because of the uncertainties around that. So the County Council is the main provider of services in that area, and it's an area that we will continue to want to provide for local residents. The consultation itself is an 8-week public consultation. It follows the normal process of County Council consultations. There is an online questionnaire. There's targeted promotion of the consultation through local media and with interested stakeholders and parties. We have had, as I said, meetings with families. We continue to meet with families, and there are meetings this week, in fact, taking place. It says in the report, as at the 22nd of February, the Council has received 35 responses to the consultation. As of last Friday afternoon, we'd actually received 44 responses, and that's a mixture of families, carers, staff, partners, and members of the public. So I'll leave it there, I think. Thank you, Chair.
Thank you, John. Mr. Robinson, you've had the written response to the question. Do you wish to ask any supplemental questions about that response?
It's not necessary to ask, but just to point out a few points.
Yeah, please come and join us at the table, and if you can switch on the microphone, that would be great.
Thank you. First of all, none of us and nobody are against short-term respite care. We had it when our children were younger and we needed it, and it worked really well. So that must be pointed out first. It's been 5 weeks since we've been told this news, and we were asked to respond how the impact has been. I don't think the impact, nobody knew how the impact would be. This is life-changing impact that whatever the decision goes, whenever it's all resolved, will stick with us forevermore as parents, as loved ones of these vulnerable adults. So the impact is massive. The trees, John's just pointed out, and it's in his report, that they've got accessibility issues. Now then, I could take any one of you and more, sit you in a wheelchair and show you that there is no accessible problems to get you around that building. I could take you to each and every room apart from one small shower room. I don't believe there's huge problems with the building. There may be small issues with doorways. We're not beyond making doorways wider. That's not a problem. The building was built for this purpose. The building works for this purpose, and it's fantastic when you see the staff working with these adults. They're difficult adults, they take a lot of work. The building's fantastic, so that's a no-no. They're talking about 9 residential positions at this place.
If I just interject, Mr. Robinson, normally we have a written report as to ask a supplemental. I think it's extremely useful that you're making these points, and that's why I've provided some latitude. But do you have any specific questions arising from the response you've received?
No, they're not questions. They're just the points on the report that you and other people are going to have to read that are wrong.
They're
not correct.
Which I believe you've covered in your letter.
Yes.
Right. So if
once again, there isn't 9 residential places at the trees. There's 8.
I'm afraid, Mr. Robinson, I'm going to have to stop you there. The way we operate is that it is an additional question based on the response you've had.
I'm just adding correct information that.
Well, that would be written in too. But I mean, if you're not going to take much longer,
I'm not going to take much longer.
That will allow you some latitude.
There's just a few
if
few
members
small
are
points.
happy.
There's not 8 residents. There's not 9 residential beds at the trees. There's actually 8. One of them has already been taken over by another means. The other one, I believe, which is vacant, I believe may be bed blocked. It refers to the report as options. We haven't got an option. We've only got one option, and that's this. And we're sort of teetering on 8 people voting on it, whether they think it's best or not. Friendships have been built over many years with residents and staff. That's all going to be lost. Assessments, there's talk of assessments being done for these adults. These assessments have already been done over many years by many people that have known these adults since younger days. So to say an assessment's going to be done by a total stranger on most of these people, solved and resolved within perhaps a few months, is wrong again. These assessments are done, they're in place, and this is why these people are living at the trees. And the other point is the private sector. I've been told the private sector do not want to take on respite care short-term beds because they're taking a gamble of their income. Somebody here has got to go back to the private sector and say to them, you're a business, you've got to take this gamble, you've got to take on short-term respite care beds. That'll solve the council's problem. And if they don't want to do that, then they go to another setup that will do it. If I start a business tomorrow, in any walk of life, I'm taking a gamble that it's going to work or not. And this private sector has got to take a gamble on the short-term respite care beds to solve your problem. Thank you.
Right, thank you for that, Mr. Robinson. Thank you to members for their forbearance. I think that's been extremely useful and has given us a real colour and flavour. The debate is now open to members. Mrs. Broadley.
Thank you, Chair. I also wanted to point out that on page 14, item 23, it says proposals and options, but there only appears to be one. So it should be proposal and option, not both. I actually know Smith Crescent, Hamilton Court very well, and I have to agree that it is not a suitable building for today's standards. Having said that, I hope that the Cabinet will certainly give consideration to use the site for learning disability services, as we do need facilities across the whole of Leicestershire, not just in Wigston, Hinckley and Melton. And it's important that the permanent residents in these in the trees and at Smith Crescent remain in the local area. It's the area that they know. A lot of them have been there for many, many years. It'll also reduce the stress on them if they've still got familiar surroundings. We talk about the shortfall in short-term care, in short break care. Some time ago, there was private individuals offering short-term breaks, respite breaks. Are they taken into account in these figures that are here, or is it just actual places that are offering short-term care? Is it the one-to-one individuals that offer breaks?
Sorry, yes, that's correct. We offer shared lives in terms of alternative on a one-to-one basis, and that's available throughout the county.
And they're included?
They're not included, no.
So we've got these short-term breaks that you've included in the report, but we've also got other short-term breaks then for learning disabilities that hasn't been included. So the shortfall isn't the same as the report then, because there are other opportunities.
Well, the shortfall is as it is in the report. There are other opportunities on top of what's in the report. So there are 44 people, I think. We received a report on accommodation at a meeting this morning. I think it said there were 44 people in having short breaks in shared life schemes across the county, but they're in addition to the numbers that are in this report.
Sorry. So can I then ask that my note that it is noted that I would like for the Cabinet to consider using the ground there, because in the report it also gives the option of selling off the ground, but it also says that it would be looked at to use for adults and communities, and to look at having a learning disability service still in Colville so that it is spread out around the county and not just in certain areas.
So yes, in response to that, and Cabinet, one of the recommendations that Cabinet made when the consultation was agreed was that we did relook at the site in Colville. And colleagues, Claire and colleagues in the commissioning services and in the council's property services are undertaking an assessment of the site to see what potential there is to reuse the site for adult social care should the proposals be agreed.
Councillor Mear.
Thank you, Chair. It's a very comprehensive report, but unfortunately it's one that I don't sits comfortable with me. I just have a few questions before I made a general statement. On one of the questions is that we have so many few residents in these buildings, but some of the vacancies are still there. I'm led to believe that care and social care is stretched, and I'm surprised that we have vacancies in these buildings. So could you enlighten me if we're putting residents elsewhere or residents being catered in the private and independent sector? That's the first question. Thank you, Chair.
Yes, so when a person is identified as requiring residential care, national policy is that people have a choice of which care home they want to go to. So we don't direct people. People have a choice. We place roughly 30 people a year in residential care with learning disabilities. That's been the number for the last couple of years. But since 2013, as it says in the report, nobody has actually chosen to move into either Hamilton Court or the Trees. There has been some movement between buildings that we own, but no new people have moved in, and people have chosen to go to alternative residential care accommodation in the private independent sector.
Short-term rest care, could it be renovated that we keep some of the long-term residents in there and provide the short-time respite in the spare capacity, and as it's horrible to say, but as capacity increases for short-term rest care, could we do it that way? Could we split the buildings? Is that an option?
In terms of the existing buildings, what we need to ensure for the Care Quality Commission is that we provide a very bespoke and distinct service within each area. So what we couldn't have in one part of the building would be to have a mix of long-stay residential and short breaks. So we do have to have a definitive split, although there are we have got within the site already a building that is adjacent but that provides short breaks. Obviously this is part of the options through the consultation that we are providing further consideration to.
Just a statement, is that okay? Just to finish it off. I think if that option is available for the residents that are there, there's only, 3 or 4 in one building, the council should explore that. But if it came to that we were looking to close it and move on, I think what we have to do is the residents say it's no win for them, because they've been there for a very long time. The report says somebody's been there for 20, 30 years, and what we have to do is if we are providing different services, I think the county council has to be generous in the provisions that it gives. Maybe if it was a new assessment, we'd give somebody an X amount level. But I think if we're reassessing these people and we can get them provision closer to home, but at a higher cost, then we should provide that for these few residents. Thank you.
Paul.
Just to add to that a little bit, actually, if there is to be a change, I mean, I know often you're quite conscious about individual assessment, and that is correct, and you've already mentioned that, but this clearly is a community. And as a community, in the options that may be looked at, is it a possibility that the community, both those in residential care and those caring for them, or at least some of them caring for them, be relocated to the same place? I know that sounds a bit, well, the word that came to my mind was brutal, because you don't want to make a change that quick. So what you talked about in transition, the transition to something which is different needs to be managed exceedingly carefully. And I think with a small community that does exist there, I think there might be an option to looking at moving individuals as a community, not individuals, if you see the difference.
I think all of the options need to be considered, so I wouldn't discount any option at this point, and certainly not whilst the consultation is live. There are obviously some issues with if we were to, each person will have to have their needs assessed and judged individually. We can't assess people as a community. Each person will have an individual needs assessment, and that will go along with such things as mental capacity assessments, etc., and families will contribute to those. What we will then do is we will look at the outcomes of those assessments to determine what the best outcomes are for each person. And it may well be that the best outcomes for an individual might be to move with somebody that they currently live with, for example, that they might have a relationship with and a strong bond to. It might also be that actually some individuals would be better served and actually would have their needs met by being with a different group of people. So, for example, the age range and of the people who live in the accommodation, the trees and in Hamilton Court is quite wide. We have some people who are relatively young, and we have some people who are frail and approaching the 70s. So it might not be that it's the most appropriate thing to move everybody together, but that is certainly a consideration that we will make. We have, as part of the consultation, had an offer from a private sector provider to rehouse everybody in a single building. So, these are options that we will consider as part of the consultation. But certainly at this point, it's not appropriate to kind of say what we might or might not want to do.
Richard?
Yeah, I wanted to gather the comments everybody else came. I think Jules started off very well. I mean, this is the toughest thing that I've had to deal with as portfolio holder in anything. I think what you've gathered from John just now, the great thing about this in one way is it's not about saving money. So it's not like there's a massive saving involved here and on many items at County Hall at the moment. It's just about making that saving, which is going to be incredibly difficult for many departments going forwards. So because it's not about money, it sort of takes that sting out of it. So once it's not about that, it's about actually using what resources we've got to help as many people as we can. And what John has sort of outlined is that the area where nobody, and it's worthy to say the private sector should step in, and I understand that, but if they're not, they're not, and there's a reason why. So clearly our number one job, looking holistically, and there's a separate part to this, is to put our money, the limited amount of money we'll always have for adult social care, never be enough, in the area that is most needed. And that's what the report's about. But, and the big but about this, is that has to, by definition, ignore the human beings who are associated with it. And the first thing that I've said at this, and John knows this, and Nick Rushton knows this, everybody knows this, Cabinet knows this, my job as the portfolio holder is to put the people at the front as if it was my brother or my sister or my parents. That's how I see it, which is why straight away the first thing I said to John is we will individually meet anybody who wants to meet us, as we're meeting Mr. and Mrs. Robinson on a one-to-one at the homes, and we've got 3 visits so far arranged, and we'll meet everybody who wants to come along, because the only way that I would ever feel happy that the process was being done properly was if those individuals who are nominally responsible, the director, portfolio holder, sit down in a private room and say, well, what about my son? What about my sister? What about my father? And that's what we're going to do. And I would have to be satisfied that the outcomes for the people we presently look afterwards were that I was satisfied with the outcomes as the human being element of it for me to be comfortable. And I've said publicly at Cabinet that if I wasn't comfortable and there was a solution such as you mentioned earlier, a hybrid, a combination, you've heard another idea from John Wilson just 5 minutes ago. There's a whole range of things out there. This process is all about the process, and the people are actually the most important thing, but we have to do the process first. So I'm very, very concerned about it, very, very close to this. It's absolutely top on my list, and I won't come back to this committee unless I felt comfortable that the way forward for the human beings was the right way forward. But there's nothing in and nothing ruled out at the moment. Thank you, Chairman.
Thank you, Richard. Michael?
Thank you, Chair. I mean, there are several aspects to this. I mean, clearly a couple of these establishments are no longer fit for purpose. Whilst there is still a bit of a sting there, I mean, we are trying to save money and redefine the service. But the people, as Mr. Blunt has said, are at the heart of this. And it's right that we have individual conversations with the carers and the individuals, but it's also right that we have a conversation with them as a group, because I wasn't aware that there was a possible option of a collective move on the table. And I think the individuals who are concerned here, families and the people themselves, need to know what is out there, and it may make this whole process smoother. If they can find a way forward, it would make our process a lot simpler, because this, as Richard has said, not entirely about money. There's a bit of money, but the people have got to be paramount, and I hope Richard follows through that we put them at the centre of this process.
Thank you, Mr. Charlesworth. Any other members wish to speak? I think it's clear from all the members' comments, and certainly from those of the officers, that all of us here care about the individuals. I think, as has been said, it is important that in some ways when we look at the original plan we dissociate the individuals, but then come back to the point that it's the individuals that matter and we do what's best for them. So I think as part of the consultation, I think we've made our voices clear to the Cabinet. I think Cabinet have echoed that by actually giving us that confidence and that confirmation that action will not be taken which disadvantages those residents. So it would be nice to see the result that comes back. But I think from all of us here, I think we'd like to assure, and particularly Mr. Robinson for coming today, that we do care. We all have family that we care about, and we are keen to do the right thing, and that's certainly echoed by our executive. So I think we note the comments, and John and Richard will take those on to Cabinet. Right, we're now taking agenda item number 9, which is page 33 of the report. And this is an update on the procurement and delivery of domiciliary care, which again is with John Wilson. Oh, sorry, it's with Sandy McMillan. Wrong name on my piece of paper.
Thank you, Chair. In June 2017, we brought an update report on the delivery of the Help Live at Home programme. That programme's now closed, and we're back into running domiciliary care as part of business as usual. So what we've brought you today is an update on where we are with the delivery of domiciliary care in Leicestershire, and really highlighting the things that have changed since we last reported to you in June last year. So what the report does is it really give some of the background to the issues facing domiciliary care. There are some real challenges across the country in delivering domiciliary care, a lot of which is fairly well publicised. But the root of it really is the availability of appropriate numbers and people with skills within that workforce. And it is a real challenge, and is going to remain a real challenge within domiciliary care services to have sufficient staff of the right calibre to provide the care and support that people need. Within Leicestershire, we're currently more than a year into the delivery of the new Help Live at Home framework. And generally, what I'm presenting you today is an improving picture. We are delivering care appropriately to people. Since June 2007, we've commissioned almost 67,000 hours. That's just under 2,000 hours per week of new care. And the time that we're taking to arrange packages of care is continuing to improve and is quicker than it was in June 2017. The great majority of work is now going to the lead providers within each lot. So that was the model, is that there's a lead provider in each lot, and the great majority of care is now going to the lead providers, and we've now got over 70% of all care is now with the lead providers, but we do still have some contingency arrangements in place where the lead provider is unable to pick up that care. And we've also continued to transfer people who are with contingency providers to the lead providers and or onto direct payments. I think broadly the quality of care has continued to improve, and so I think the number of complaints received from service users is now back to a stable position. And I think in the context for this, we are obviously delivering thousands of hours per week, so the number of complaints is got to be seen in that context, but around about 14% of overall complaints relate to domiciliary care, which is, given that it's the second largest service, is a reasonable position. I've just also point out something that's not in the report, because it's happened since the report was written, is that we obviously had a period of very poor weather over the last week. That presents some real challenges to delivery and of services, and is a real test of the robustness of services. So to deliver domiciliary care in those kind of circumstances is really difficult, just from the way of getting staff out and into rural parts where there may well be roads blocked and whatever. But actually, the providers coped incredibly well during that period of severe weather, and we really had no major disruption, and we didn't have any significant problem reported with missed or delayed calls. So I think for me, that's kind of, it's one of those things where you kind of think things are going well, you have a test of that, and it looks like the service responded extremely well. In terms of the other issue which is addressed within the report is the re-procurement of the 3 lots. So we had 3 lots which didn't commence on the start date with the others because of the withdrawal of the provider who'd been allocated those lots. So that's 3 lots in Hinckley and Twycross, Gruby and Market Bosworth, and Mount Sorrel and Quorn. Those contracts have been awarded, and those 3 lots commenced on the 6th of November. It's almost exactly a year after the start of the other lots. And to date, that has gone well, and those 3 providers are active and are delivering in line with our expectations. And then the final issue is just to highlight where we are in terms of delivering the savings requirements associated with the letting of the last framework. So there was a savings target within that of £1 million, and that target has been achieved. So that is money which is now taken from the budget and is now fully achieved as part of the MTFS. And that's achieved through kind of a variety of means. Partly was a small saving from the average hourly rate for the new contracts, but also a bigger part of the reduction was actually achieved by reviewing all the people who were transitioning and ensuring that they received only the care that they needed. And there was a 7% reduction in the number of service users receiving council-funded care, many of whom have continued to fund their own care privately. And there's also been a reduction in the average number of hours. Now, clearly that's not, everyone hasn't had a reduction. Some people have had reductions, some people have had an increase, but on average there has been a reduction in the number of hours per week of home care, and those combined measures have resulted in the achievement of the saving. Okay, I'm happy to take any questions later. Thank you.
Sorry, thank you, Sandy. Michael.
Thank you, Chair. Yeah, just a few quick ones. Under section 5 on page 33, it mentions the difficulties about retaining staff. I mean, the last sentence goes on to say about the complexity and frailty of service users is increasing. Surely, for these companies to keep staff going forward, they've got to do better rates and retention. If we want skilled staff to stay on, I just think they're running it on a shoestring. It's very tight for them. We set a very tight target for them, an hourly rate. In doing that, how can we expect them to keep staff who are getting better trained and being able to deliver what these service users use? That's the first question. Second one, the 3 new providers on page 34, are they all working standalone, or have they had to have any contingency support in those areas? And of the existing providers, how many of those are receiving contingency help? Of the original ones that went in December 2016, how many of those are still needing support from us? And finally, section 15 on 35, the average rate for the delivery under the new contracts is 15.821. When you say new contracts, do you mean those that were rolled out in 2016? So can I have the hourly rate for the 3 new providers? Is it had to increase? Is it about that, or is it less? Or thank you, Chair.
I'll try and remember all those. The staff retention issue is a really major issue, and the levels of turnover are high here, and they're high in most places. The Skills for Carers figures show the slightly higher levels of turnover in Leicestershire than nationally, and the real difficulties in recruiting and retaining staff are mostly in the rural areas. That actually there are many fewer problems in the more urban areas, and a lot of that's to do with just the availability of alternative work for people. One of the aims that we had within the framework was to improve conditions for staff. I think largely that has happened, and pay rates are now significantly higher. A lot of that's because if staff were paid, if providers were offering national living wage, they just would not be able to recruit it is a very competitive market. So I talk regularly to the providers, and the going rate for domiciliary care staff is now between £8.50 and £10 an hour. That is the going rate, and all the providers are now paying for all travel time, and again, they wouldn't find staff, I think, willing to provide a car and to travel, and they wouldn't be able to provide services in rural areas if they didn't do that. We are really aware that we've got to improve the attractiveness and the kind of career pathways within care services generally. Because if care services are just entry-level jobs that stay entry-level jobs forever, people are never going to view that as a career choice. Particularly young people are not going to see that as an attractive place to work. So as part of our workforce strategy, we are looking to develop a project around how we can improve, working with the local enterprise partnership as well. How can we improve the attractiveness of that as a career? How can we help improve the image, but actually improve the reality of what a role in care service can offer you in terms of career progression? And training and development will be a key part of that. And we do have free and subsidised training that we offer to providers, and we're likely to want to expand that offer, because offering people career development is again important in terms of changing the image and how people actually view that work and what it might offer them in terms of other career options. Because I think the real problem is that a large number of people are not just leaving their employer but leaving the sector, and we don't want them to do that. If people are going to move, we want them to move to better career opportunities elsewhere within the sector. I think you then asked a question about the 3 new providers. It's not, I can't give you a kind of completely straightforward answer to some of that. Servicare were in an interesting position, and they because they were actually the biggest contingency provider already within that lot, they actually started with having a third of the business within the lot on day one. So they were already very well established, and they have continued to take all the work within that lot. So since they took on that, none of that work's gone to any other provider. It's all gone to Servicare. Medax, who were also an existing provider and actually had a neighbouring lot, they didn't have so much business to start with, but they have also taken all the work since the beginning of November. Direct Health, who were a new provider to the area, have taken on most of the work, but a small amount of it has gone to contingency providers since they took it on. But they are still taking on the majority of work within that lot. And your third question was about are we still using contingency support elsewhere for other providers? I mean, there's a variable picture on that, and we monitor the percentage of work that providers have. So most providers are more than 70%, and there are some providers which are less than that. But we are still using contingency providers in some lots, and we're likely to need to continue to do that for some time. What I would say is that we are monitoring carefully what's happening with the contingency providers, so we have to make sure that the quality of care is appropriate for those contingency providers, and we're also ensuring that the arrangements we're making still provide value for money. So we're checking that the rates that we're paying to contingency providers are in line with those for the lead providers, and they're within each lot. They're within a very small margin of the amount that we're paying to the lead providers. Has that answered all your questions? Have I missed something?
I hate to mention Brexit, but if any of our providers are heavily reliant on EU nationals in providing some of this care, I think it's legitimate of us to ask that question of them because we don't want to face a cliff edge at some point in the next 18 months, 2 years, where we then have another problem. I don't know whether it's going to happen or not, but I just think we need to be aware of it.
We don't have figures for what percentage of the workforce is from EU country. The domiciliary care workforce is from EU countries, although Skills for Care do publish that for the overall care workforce. So from that, I think the figures from memory is that 4% of the workforce are EU nationals, but 9% are non-EU nationals. So there's actually more people who are citizens of other non-EU countries than there are EU countries. But clearly, there is a significant element of non-UK nationals within the overall workforce, and they're an important part of the workforce.
My concern, Chair, was that if one particular provider has gone to a particular group of countries for their Bulgaria, Romania, whoever, I just wouldn't want them. They may have 50% of their workforce, some may have none. I just wanted us to be ready for any shocks.
Any further questions, members?
Thank you. I notice on here about the discharge from hospital has improved. It's gone to 12% as opposed to 25%. The delay of social care being put in place. Is that anything that we've done, or has it just happened magically, or have we put in some robust action there? Thank you.
Well, clearly I'm going to say that's something that we've done, aren't I? Yes. I don't believe in magic, I have to say. And coincidences are just... I think it's a range of things. So one of the things that we did, one of the outcomes from the new Help to Live at Home model of service was that we focused our reablement capacity entirely on hospital discharge. So whereas previously our in-house reablement service, our heart service, was providing reablement services to people coming out of hospitals and to people in the community. When we put the new contracts in place, it was a requirement of each of the domiciliary care providers under the contract to provide reablement services in the community for new people coming through. And that meant that our heart service could concentrate entirely on hospital discharge. I think that's had a very big impact. We've also, at the same time, been working very hard around the whole delayed transfers of care process to speed up assessment timescales, to ensure that we've got the appropriate care arrangements in place that people might need, whether it's reablement or residential or interim care, or we've had reablement beds that we've commissioned on a bed-based service. So we've been working really hard all year to reduce the numbers of people. So what we found is that the overall number of people who are delayed in hospital due to social care reasons has dropped considerably. But even within that smaller number, there's a much smaller percentage of people now who are delayed because of awaiting a care home package.
If I could come back on that, do you therefore not foresee it continuingly to get better? Or have you reached a watershed?
No, I would hope that we can still improve, absolutely. There's always improvements that we can make. There are certainly authorities in the country, and some not very far from here, who have lower figures than we do. So absolutely, I think we can still improve. And as Sandy said earlier in the report, the waiting times for picking up packages of care. So we track from the point when we requested care to the point when the provider can actually deliver it. And that gap, that waiting time is coming down all the time. It's improving all the time. So we absolutely anticipate it getting better.
Excellent, because the knock-on of that is amazing, isn't it? The difference it can make. Because if the care is delayed, then obviously the patient takes up a bed. if the care isn't put into place when they leave hospital, they can end up going back into hospital. So thank you very much.
Any further members got any questions? Right, so we move on to the next agenda item. Just before I do, people might have seen Councillor Meir disappear from the room. He's been called away on a pressing personal emergency, so he did let me know he just had to call. So just so people don't think he just left the room. We'll now move on to agenda item 10 on page 57, which is the draft Leicestershire and Rutland Living Well with Dementia strategy, which is clearly with Sandy, because it says John on my piece of paper.
Thank you, Chair. This is the last one from me. So this is a report which is going to go to Cabinet on the 9th of March, and it's been brought here for members to be able to consider it and comment on it before it goes to the Cabinet later this week. So the purpose of the report is to seek approval to take a combined Leicestershire and Rutland draft Living Well with Dementia strategy out for consultation. And it's a recommendation to the Cabinet that they agree to that, and that the consultation should get underway. What I emphasise is this is quite a complicated thing from a governance point of view, because when you're trying to agree a joint health and care strategy across 3 areas, so there's 3 local authorities and 3 clinical commissioning groups, all of whom will be taking this through their various governance arrangements, and that's quite complex logistically, and also every single governance body may want to comment and make changes. So it's actually quite a complicated thing to take it through all those bodies and then take something out to consultation. So actually, I think it's the Leicestershire County Cabinet that's taken the first step in that rather complex process on the 9th of March. So the draft strategy really is a response to how we deal with kind of the overall issues with dementia. So it's not primarily concerned with how we provide care for people with advanced dementia, although that is part of it. It's actually about the whole approach to dementia, right from the very early stages and diagnosis right up to end of life care. And the strategy is looking at how we can improve what's available for people in Leicestershire and Rutland in all those areas. So I won't go through the strategy in detail because it is attached to the report. But what I'd say is that this is a kind of key issue for the council and for all the other partners, just because of the kind of challenges that dementia is posing to us. As we live longer, more and more people will have dementia. More and more people will die with dementia as other conditions become more treatable, and people survive for longer. So it is something that's going to affect a lot of people. We have to improve the identification of people and the diagnosis of people. We have to get people information and advice, and we have to get people the kind of support we want, and we have to build dementia-friendly approaches into all areas of living. This isn't just about health and care. This is about how we as a society respond to the needs of our fellow citizens with dementia. The process of consultation is outlined within the report from paragraphs 44 to 48, but it will be a fairly standard process for consultation. I think we'll be doing that jointly with our partners. And we haven't got a specific date for when that will start, because we have to get approval from all the partners, but we're planning that will be a 6-week consultation, engaging with as many people as we possibly can. And there's also an equality and human rights impact assessment attached to that. And I think there's a lot of work being done in trying to pull that together, really about how we can recognise the very complex needs of people with dementia and how we can respond and make sure that all that we offer around dementia support takes into account people's background, their ethnicity, their age, and we'll certainly be ensuring that everything that we commission takes those into account. Thank you.
Thank you, Sandy. Michael?
Just a quick point, possibly my ignorance, no doubt, but I was quite shocked when I read paragraphs 20 and 21 to realise that over 10% of over 65s in Leicestershire are living with dementia. That shocked me. I mean, I don't know much about the subject, and my grandma had it, but 10% of over 65s is quite a sobering figure. So clearly this strategy needs to be in place to deal with that. Can only be described as a crisis, I would have thought.
Any other members wish to comment? Paul?
Likewise, welcome it. When I first read it, I had the impression that there wasn't much mention of people with early onset, but having reread it, it's actually front and centre. I'm not sure it's not got a page number. It's on after the introduction of the strategy in point 2, what is dementia? It highlights younger people with dementia often face different issues to those experienced by older people. And then if you turn to page 82 and 83, you get a flavour of significant but low numbers between the ages of 30 and 64, where I currently sit. In Leicestershire, in 2017, 184 people. So you could call that a very significant number as well, in terms of people of a young age having early onset dementia. And then there's figures for the city as well. Actually, the figures in the city are slightly less. It's 75 with early onset dementia. I don't know what that is percentage-wise between the county and the city, but it's just heartening to see that the strategy does take account of everybody with dementia. Thank you.
I mean, I think I echo the point Michael's made. I mean, page 70 astounded me when it says that 11.6% of all recorded deaths in the UK are down to dementia. It's a staggering statistic. And again, the point that Paul makes that whilst they may be small in number, I think from the page 72 it says there are 179 people under 65 with early onset dementia. You know, clearly it will be difficult to look after a cohort that small in number, but is one that is clearly not forgotten in the report. So I think I'd echo what other members said. This is a crucial report, something we desperately need. It's a policy we desperately need, and I think we applaud the efforts we're putting into this to make sure we get the right strategy. We now move on to agenda item 11, which is on page 99, which is again the draft Leicestershire Adult Learning Services Strategy. You see, John's doing absolutely nothing today. It says on my form, but it's now with Nigel.
Sorry. Thank you, Chair. Good afternoon, everybody. The purpose of this report is to ask Cabinet, it will go to Cabinet on Friday, to seek permission to undertake a period of consultation on a draft adult learning services strategy, which sets out the strategic goals for the service. And you have the strategy appended to your report. Just a little bit of context. The Adult Learning Service sits within the Communities and Wellbeing Service as part of the department, and it draws its funding down from the Education Skills Funding Agency, formerly the SFA. And it's a county-wide service, and it aims to support people, communities and businesses develop and engage in learning programs to suit their needs, and those cover a range of needs from very informal learning opportunities, what we might have in the past called night school, to more targeted areas of learning around skills and employment, getting people skills ready, employment ready, building community confidence and so forth. And it does it by a range of accredited and non-accredited learning programs for which it draws down ESFA funding on a payment by results basis. It's a very localised service. It operates across 104 venues and delivers somewhere in the region of 33,000 guided learning hours, and that's learning supported by a tutor to approximately 6,000 learners every year. Community education services such as LALS are regulated by Ofsted, and in 2015 the full inspection of Ofsted rated the service as good, and Ofsted re-emerged in February of this year for a short inspection, and again we maintained our good service, which is very positive. So the draft LAL strategy, as you have it, sets out how the service proposes to focus its activity to contribute to 4 of the 5 key outcomes that are identified in the County Council strategic plan, which are a strong economy, wellbeing and opportunity, keeping people safe, and great communities. And the strategy maps out what the adult learning outcomes would be as aligned to those strategies. In case you're wondering, the fifth outcome is around housing, and we felt it was probably a very limited contribution that we could make to that, so didn't include it in this draft. So, like the other strategy, it's proposed to undertake a period of consultation from the 2nd of April, should we get approval on Friday, to the 31st of May, through, again, standard approach to consultation. We will be looking to engage with learners themselves in terms of the strategy, but also seek to ensure that stakeholders such as ALEP and other people that might be interested in the contribution that adult learning has to local communities and the county as a whole. And then we'll take the final strategy back to Cabinet for approval in July. So I'll happy to take any questions on that.
Any questions from members? You've met with stunned silence. We know from... Sorry, Paul.
Just looking at page 103 and the point 27, you could link it to housing.
Thanks very much.
If people are training in, for instance, ICT employability courses, they're upskilling for a better job, to hit the affordability ratios for mortgage lenders to purchase a house.
Okay.
But I understand that we didn't have a strategy before. Is that correct? So hopefully the Ofsted rating will go to a little, well, let's say a little higher.
Yes, this is the first time we've had a published document that really tries to ensure that we're strategically positioned to deliver, that we're not just operating a service just for the purposes of operating a service. I think it's really, really important, particularly in sort of the environment that we're in, that services are sort of aligned not just to the strategy that we've mapped out against, but other strategies that exist and we've referenced in the report itself.
I'll be bold, I'll ask a question then. And it goes on from the point that Paul was made on page 103. We know from national government statistics that illiteracy and innumeracy rates have gone up staggeringly high. They're the highest they've been since Victorian times. But we note that English maths tuition comes quite low in this. So what is the strategy doing to reach those people that actually need that upskilling so that they can go into the workforce and actually progress?
English and maths is, if that comes across as being a low priority, it's not. Ofsted when they inspect, they look for evidence that we're embedding English and maths skills in all sorts of programs, not just English and maths classes. Adult Learning Service does a variety of activity, from family learning sessions, which are free, that bring people together to do very informal learning. It's not accredited, but involves, as a family, things like basic, what's called functional skills, I guess, in terms of English and maths, to specific English and maths GCSEs, to support people. So LALS will do a lot of work about introducing people that in the past learning might have been a barrier. They might have not had a good experience at school. They've left school, but they feel that maybe they want to re-engage. So the value of services like LALS is that we can do that at a very local level, very informally, and get people build up their confidence to undertake programmes that they might not have considered in the past. So Ofsted we do have to make sure when they do visit that we've got evidence that shows that we are embedding English and maths into a whole variety of learning programmes.
Perhaps didn't phrase it right. What I was trying to do is work out what we might be able to do communication-wise to encourage those people to come into it. I understand that once we've got them, we can do it. It's how do we get to those hard-to-engage groups that might benefit from that type of learning.
So we have a team of engagement workers that work in the community, and their job is to obviously look at what activity is happening in targeted community areas, look at and build up relationships with potential partners, maybe schools or so obviously libraries, and other organisations, other providers, and really then to begin to sort of advertise and go to events, skills fairs or whatever happens to be organised in the community, to advertise the fact that sort of there is sort of learning isn't necessarily sort of signing on to a course. It can be much more informal than that, and try and recruit. And once it's got enough people that are willing to undertake a programme of learning, it can then put a course on. Of course, it has to make sure that there's enough people and that those people stay the course. We can't draw the money down if we recruit 20 people and then 10 people drop out for whatever reason. So as well as that, there is an information, advice and guidance team that makes sure that before we begin to put people on an appropriate programme, whatever that might be, that we've done as much as we can to ensure that it's right for them, that we don't sort of promise something that perhaps that they're not in a position to follow through. So we try and make real effort in terms of local engagement at that level.
Brenda.
I feel emboldened now to be able to ask a question that I don't quite understand this. So we are still on 27, and so the question I was going to ask was, what does the percentage in brackets, what is that representing?
Okay, so you've got a list there of the learning profile of the delivery. So
Right.
in terms of English and maths tuition, 24% of our profile is based on English and maths tuition. If you look at work-based learning, which is apprenticeships, we run an apprenticeships programme, that accounts for 8% of the total LALS.
I've just added
So
up.
yeah, if
It's
you had
100%, yeah.
if you had a pie chart of our
You see,
activity,
I do
that's
feel
how
a
it
bit
breaks down.
silly now. But my question that came from your answer on that, I picked up that you said we, and I presume the we is the county council, a team of engagement workers, and then a bit later on it was a team of advice and an advice and guidance team. Are they one of the same? How many's in that team, and who are they assigned just to LALS or? Yes, thank you.
Okay, so it's two separate teams. LALS is organised across localities, north, east, south, west. And there'll be a very small engagement team, 1 or 2 people in that area, and their job will be to go out and do that work. There is another small team, information, advice and guidance, and the teams work together. So, they might, for example, work with a local area coordinator, which isn't a LALS part of the service. It's part of county council provision that targets harder to reach families and supports them. But they will do work with them perhaps. They will then, if there's some interest and sort of people do want to take up learning opportunities in whatever form that takes, then if appropriate they'll be linked with an information, advice and guidance person. It's a bit like careers advice, so but not so formal. They'll have a chat, find out what they want to achieve, what their goals are, and at some points those might be very limited goals, and try and match a learning opportunity to meet those goals, rather than to say you need to do GCSE English or Maths, which might be, for some people, 3 steps down their pathway, if you like. So they will work together like that. So there's 2 small separate teams that operate across localities.
Right, thank you, Nigel. We'll now move on to agenda item 12, which is the Archives, Museums and Heritage Collections Hub proposal, which I am reliably told this time will be in the hands of John Wilson.
Well, I'll kick off, but I may hand over to my able colleagues. Yes, so there is a report being prepared for Cabinet for April of this year. And ahead of that, we wanted to bring a report through to Overview and Scrutiny Committee for your views and comments as part of the development of that report. So we have been working for some time with colleagues across the council to look at the potential development of a heritage and museums and records collections hub. Effectively, what we're talking about is a storage facility that provides a safe, secure, temperature-checked and humidity-checked storage for the county's records, which are currently stored at the Records Office, and we do that in cooperation with Leicester City and Rutland. But to bring those together with the museums and heritage collections, and we have those stored across the county at the moment in 5 different places. And also bring together the registration records that the County Council stores currently on the County Hall site. What this will do is it will provide us with a modern facility that not only provides to ensure the archives that we have and the items that we have in our collections are stored properly for future generations. It'll also provide a facility that provides for the County Council for the next 20-25 years. We have, alongside the legal requirements that we have for the Records Office and for the registration services, we do have a varied and, in some areas, quite unique collection of items that are accessioned into our museums service. And it's important that we ensure that those items are stored properly and that they can be accessed properly. And of course, the problem with having those items across different areas of the county is that it can be difficult for the public to access some of those items. So this will also provide people with public access to the collections in a way that we can't currently provide that. The development is part of the Community and Wellbeing Services medium-term financial strategy. So there is a £350,000 potential revenue saving, and that's through bringing together the various different aspects of the collections and the records and bringing the teams together. So there will be a revenue saving as part of the process. But clearly, bringing together all of these various collections and storing them in a manner which is fit for the future is also quite an expensive undertaking. And it will require significant capital investment in order to develop the sort of facility that we would want to develop and that we think that the county requires going forward. We've worked with, as I say, colleagues in property services and in other areas of the county council. We've also engaged with an independent sector company to provide us with support to develop a business case. We've looked at a number of options. We undertook a feasibility study, which had a long list, if you like, a long list of options. We got that long list down to a short list, and the short list was then taken forward as part of the feasibility study that we asked an independent sector provider to undertake on our behalf. So the business case that you've got in the papers today essentially has 5 options that they were asked to take forward, and they're outlined on pages 126, 127. Of those 5 options, clearly there are recommended options that will go forward to Cabinet. We won't just put all 5 options together to Cabinet and say, here's 5 options, please take your pick. We will make a recommendation. And I think it's fair to say that our recommendation at the moment would be towards option D, which, sorry, I've got the wrong one? C. C. Option C. Yeah, option C, sorry. Which is the refurbishment of the eastern annex at the rear of the County Hall campus. I'll leave it there, I think, for the moment. I'll ask questions, and if there's any detail, I'm sure Nigel will.
Right, I think Michael may be first, but I'm going with Mrs. Broadley first.
Thank you, Chair. On page 126, you've put here as option B the site in Wigston, even though it doesn't actually cover everything that you would require. Obviously, the Records Office could store more of its own records, but it couldn't store everything else on that particular site. So I'm quite disappointed, and I'm sure it'll come as no surprise, to see that the Burkitt House site hasn't been included as an option, because it's in Wigston, it's close to the Records Office, the school has moved, it's there, it's accessible to everybody, and there is a lot of parking there. Whereas if you're going to prefer option C, the parking here is horrendous, as you know. Yes, you'd have to do something. Is there going to be designated parking for the public to use, hence staffing problems with parking? And I know a suggestion was placed on maybe levying a tax on staff to park, which I would like to use that in the future, I think. But could we have a look at, I know these are the options that are going to go forward, but could we have a look at the Burkitt House? It is owned by the County Council, there are plenty of parking, and it is local.
Okay, thank you. We were aware of the site in question, and when we were liaising with our colleagues in property, obviously our preferred option would be a site that covers all of the things that John has outlined. The case with that site was that it was too small for what our requirements would be. We're not just thinking about the record office, and that has to expand in order to, take on, sort of any records that are bequeathed or we feel that we have to take on board. But it would involve, we would need a site to make sure that all of the range of other services are there, the collections that the museum's service hold. It surprised me when I first came into the service that something like about 95% of our holdings, our collections, if you like, that we hold in trust for the people of Leicestershire is not in our museums, our public museums. They're actually in the sort of the variety of locations across the county. So we were looking for, our ideal option, our preferred option would be a site that does all of that. If we were to look at the site that you referred to, then we would need to look at that as on a split site, which is very, sort of almost, sort of going back to where we are now. We've got sort of the Records Office, but we've got other sites as well, and we probably have to do that if we looked at that option.
I apologise beforehand, Mike, I will get to you, but Richard did wave at me first and I missed him, so... Oh, he's deferring to you, Michael, there you go.
That's most generous, Richard, thank you. Having visited Barrow, it is an absolutely enormous site. and the stuff they have got there. Trouble is, it's in an inaccessible place. I suspect that you get a handful of people there, and what I would have liked to have seen in this report is some of the usage figures of these various sites around the county, because I know I had to sign in at Barrow, so we readily accessible, how many, dozen people a year, 200, who knows, and the other locations as well. And I do agree from the outset, under one roof would be absolutely great. But as I said when we first mentioned this at a previous meeting, accessibility is the key for me. Yeah. It's got to be accessible, and whatever we do, whether it is the Eastern Annex or whatever, it's got to be, County Hall isn't the most accessible of places. If you're on public transport and you live in the south of the county, you've got to do it to at least 2 bus journeys, at least. I know in D it mentions the car parking. I think whatever we do, we're looking at a capital spend of a significant amount of money. Like it under one roof, I would loathe, the records office is on my patch. It's been there a long time. I'd loathe to see it go. I just wonder, do we lease the building or do we own it, and what the future of the building is going to be is a concern of mine. But if we go down the route, and I don't know whether we will, of C, with probably a mixture of D, because you've got to increase car parking, and that's all about the accessibility. It's also about what we do with the collection if it's in the Eastern Annex. It's no use just having a huge building that's climate controlled with all the stuff in there, which is not presented in a way the public can view it. The public need to be able to go in there, school trips, whatever, and be able to see stuff displayed. At Barrow, it was all, the pictures are all in all the dresses, wonderful dresses and costumes are all on racks. But people have got to be able to see stuff. You've got to be able to appreciate it. You've got this wonderful line of paintings down the corridor over there. Everybody can see those. So that's my point. And there is the potential for an earner. If it's well presented and it's good access, you can then start thinking about making an income out of it. And that would be great. People are prepared to pay a couple of quid, whatever it is, to look around this fantastic, because it is fantastic stuff, no two ways about it, but nobody sees it. So whatever the solution is, it's got to be something I would have hoped along those lines.
I've called Richard in there, he's dying to get in.
Well, I'm going to go into because I have to leave at 3:30, and if I don't, I'm very pleased that on my watch, this paper is coming before you today, because 5 years ago I took over the portfolio for libraries and museums. I got to the records office very early in my job, and it was quite clear that it was full to capacity. We weren't doing our job, and I always say I think that's the county council formed by whichever, William the Conqueror, whoever it was. We had a history lesson earlier about literacy since Victorian era. We need to polish up our history, but I would certainly think that one of the first jobs in the county is to keep the records. It's part of our history, it's part of our democracy, and we're not doing a good enough job. The fact that it has to be pointed out that the Byron has allocated the capital spend on this of a huge amount of money at a time when money is tight, but the capital expenditure will be big. I think I'm glad I deferred to you, because your point about the looking at the visitor numbers is important. It should be part of any paper going forwards. We know the number will be pitifully small. And there's a number of reasons for that, and partly because the National Trust will tell you there are many, many people who want to walk around the grounds of Cork Abbey, but only a few want to pay to go inside. There are many, many people who want to do lots of things. Actually, in some ways good. People are trying to do lots of things, but overall we need to make sure it's available better than it is now, but it's never going to be at the standard where 90% of the stuff can be readily visited by many people. But it will be better than it is now. But that needs to be quantified, because we need to demonstrate value for money. We want to know the increase in the ability of people to see our collection with the new service, because actually that is the win. We're doing our job properly, but we want to see one of the wins should be more people getting more access. Thank you, Chairman. I'm going to go at past, so if there's any questions for me, I would appreciate it.
Paul.
Thank you, Chair. I would very much support what Councillor Charlesworth has said, because one of the key points about a collection is its accessibility. Accessibility to the public, accessibility to share it around the country and receive items in from around the country. Museum isn't static. I'm going to call it museum, but a collection suite isn't a static entity. I would like the Cabinet to think about 25 years. That's a long period of time. That's a long period of time to consider accessibility and parking. And I'm wondering whether option D gives you a double win in terms of you're providing a records office that is bespoke, you're providing a collections hub which is bespoke, and you're also providing a car parking capacity that would meet the need, I would assume, of visitors and of staff. I'd also like you to consider, and I don't know if this business model would work, but in 25 years I would say the number of cars and their various methods of powering would change over that period of time. Is there a business model in terms of footfall, in terms of car usage, to lease out space for electricity charging? I don't know how that operates. Whether an operator puts in something on someone's land, they get the income from the charging, but you charge them a rent for having the charging site on your land. So I think there's more imagination that could go into both C and, but particularly D, to give you more wins for the County Council over a 25-year period. I think option D gives you some opportunities. Thank you. Oh, sorry. I remember something I've written down here. If you're not aware, and it's not my university, it's the University of Leicester, there is a very well high regarded museums department there. Now, I know you're not a museum, but you're a collection. But they might have some networks and they might have some contacts that you could use to help you in the design of a new hub.
I'll answer the first part. Yeah, I mean, I think you're absolutely right to sort of have a look at all of the options. And what we have done is ask the independent consultant that we worked with and our own internal finance and commercial teams to have a look at what we think the value, and what was presented here is net present value. And don't ask me to explain net present value in detail. But essentially what it is the return over a period of time from a level of investment. And those net present values are detailed within each of the options in terms of the expenditure that would be incurred against what that value might be worth in 25 years' time or 20 years' time, etc. So we have tried to look at where we think the best value is for the council, or at least what the returns on the investment would be over a longer period of time, and that's the calculation, and it's quite a complicated formula that they use. And I'm not a mathematician, so I'm not going to go into the detail. Nigel might be able to explain it, but certainly we have looked at that. But equally, absolutely, we take on board your comments about actually, we're not building this for today and tomorrow. We are building it for the next generation. In terms of the second part of the question, I don't know if you want to respond, Nigel.
Just in terms of that, the university aspect, is that what you're interested in? Yeah, I mean, we are aware of the that service. I mean, should once we get to a point where we've agreed and recommended and had agreed an option, then there will be an element of consultation in terms of the building itself. It won't be a consultation on the options, because we'll have by that stage agreed, sort of what out of those we will be going forward with. But once we know that, then that gives us the opportunity to engage further with stakeholders about the design and of the features and so on. So we would hope to take that up once we've got the decision in April.
Right, a sneak in mine then. So a question on page 133. That I'm surprised we don't know when the lease expires. I assume we've got a copy of a lease we've signed. which puzzles me. And if we don't, how can we determine what the savings are likely to be? But secondly, I think I sense from across the committee that whatever decision is made, I think there does seem to be an overall thrust that one building would be better. We're all very keen on accessibility, and therefore there's got to be dedicated access for people to be able to park and visit the collection. And I think, I hope I'm speaking on behalf of the committee there, tell me otherwise when I say I'm sure this committee would be delighted for it to come back for us to look at stage 2 of how the building might be laid out and developed and what access it might have for various collections based on particular comments from Michael and Paul. Or do I get my answer first?
Oh, sorry, no, go on.
On page 133.
Yes, sorry. As we, I think, as said in the report, this isn't the final report. We are still in the process of putting the report together for Cabinet, so this is a kind of a work in progress. But we will certainly ensure that those figures are in there before Cabinet see the report.
It wasn't a figure; it's just a date. I thought we'd
know a date. Sorry, I meant yeah. So yes,
I thought we'd know the date.
It's
now,
the lease for Barrow. Yes, that we need to
Yeah.
put that into the report.
Yeah.
Absolutely. There are some other figures as well we need to put into the report.
Brenda.
I'm going to apologise beforehand because I must have read this wrong and completely misunderstood it. But I have read it several times, and I don't know where I'm going wrong. But I too think it ought to be central and easily accessible. But we're not really thinking of building a building round about the 28 million that has only got a life expectancy of 20 years. Or have I read it wrong? Because it just says, and provision of a building that will be fit for purpose for the next 20 years. That seems a heck of a lot of money to pay on a building that only will be fit for purpose for 20 years.
I suppose, yes, it's a lot of money, however long the building is. What we're looking at is what we can foresee in terms of our storage costs. So we're not saying that the building will fall down after 25 years, but we're thinking about what our storage requirements will be over that period. So that's where the 20 to 25 years comes in. And it's difficult to see beyond that. I mean, it's difficult to see 20, 25 years is quite a long period of time. Obviously, we know how much growth we've had over the last 5 to 10 years. We know what our current collection size is. Clearly, there will be some decisions that will be made around the future collection and whether we retain all of our collection or whether we dispose of some of the collection or transfer some of the collection. But it's more about the collection requirements and storage requirements than the lifespan of the building itself, if that makes sense.
Thank you. I'm relieved it's not a prefab then. Thank you.
Michael.
John's disturbed me. Disposal. You use the word disposal. I know many of the bits of the collection come with conditions and various codicils and bits and bobs with them about disposal or otherwise. I know Northampton went down a very rocky route selling their Egyptian statue because they needed the money. I understand the motive, but the museum people in London took a very dim view and took their accreditation away. If we're going to dispose of anything, are members notified beforehand of anything that is before it's disposed of? Are members notified?
I think we can't just dispose of stuff. There are lots of rules about the processes that are governed by the Museums Association and the National Archive in terms of what we do. So any decisions about any disposals would have to go through those processes and follow, I would imagine that we would be, coming to Cabinet with a decision, particularly for significant collections. But I'm not aware of any plans like that. I think we just have to be pragmatic in today's world, that we're just not in a position where we can just take everything, because it depends on what value that has. Obviously, if a significant employer went bust and the archive was there, then we would have to obviously seriously look at how we would accommodate that. We wouldn't say, no, we don't want it. But there might be other things where we actually say, well, sort of, we've looked at this and we feel probably, sort of it doesn't have a place in the collection. So it's about being a bit more targeted in terms of what we do. But we're certainly, there are quite stringent rules and regulations about how services go about disposal. They can do it, but it's not something that is done lightly.
Just to add to that, yes, Nigel's absolutely right. There is a process that we follow. We have a disposal policy, and as part of that policy, any decision on disposal is a member decision.
In that case, Chair, I'm more than happy for those paintings to go in the corridor.
I did think you were bidding for certain pictures, Michael. I clearly misunderstood. I agree with Richard. This is quite an exciting proposal, and I think anything that can make our history accessible to our residents has got to be welcomed. And I'm sure I speak on behalf of all of us that we've been the first cohort of visitors. In fact, it might actually be better to have our meeting in there on the day it opens. We'll now go to the final item on the agenda, which is agenda item 13. Which is the future strategy for the delivery of library services, Braunston Town Library, on page 171, which is in the very capable hands of Nigel.
Thank you, Chair. So the purpose of this report is to update and advise on further engagement and activity within Braunston Town regarding proposals to transfer it to community management. You will recall to date that we've got 31 out of 35 libraries that are managed by local communities. And the background to progress Braunston Town in that are detailed in paragraphs 18 to 24 of the report. But in summary, work had progressed with Fabula, which is a social enterprise, and subsequently Braunston Town Community Library Group, in making a transfer to the Braunston Town Community Library Group. And those steps were reported to Cabinet at the time. And this plan would have enabled the County Council to sublet its long-standing lease with the venue on which the library is, which is part of Braunston Town Council's Civic Centre. However, unfortunately, the Braunston Town Community Library Group has concluded with regret that its plans have become unsustainable due to a variety of factors, time pressures and lack of staff capacity. But I do think it's important to note that this is by no means a reflection on the efforts made by everybody involved in making the journey so far. So because of this, officers have considered a number of options in order to determine the future of the library and the space that's leased by the County Council that occupies, on which the library occupies. And those options are detailed in paragraph 31 of your report. And the report recommends that option 2 is adopted, and this is to adopt a proposal which was previously submitted by Braunston Town Council to manage the library within its own resources, but with the County Council continuing to honour its lease obligations, which it has to do regardless of what happens to the site. Those lease obligations are detailed in paragraph 18 of your report. So we feel that this option is pragmatic in terms of it's the most pragmatic way to sustain a library service in the area. It does have strong town council, local member and local community support. And as I've said, whatever the county council does, because it could decide to close the library and put another service in that site, there would still be an obligation to pay the running costs, which are around about £17,000 a year in terms of that lease. But this option would enable the library to continue to operate within its current site. Now, throughout this period, officers have been engaged with the town council and our local member, Mrs. Hack, in terms of this. And last week, the 22nd of February, The Town Council's Policy and Resources Committee agreed in principle to accept the Council's offer to manage and operate the Braunton Town Library, and that should the decision be approved at Cabinet on Friday, then their executive officer, Town Clerk, would work with us in terms of negotiating a detailed legal, financial governance and management arrangements in order to progress the transfer. So that's the paper. I'd be happy to take questions.
Michael.
Yeah, under paragraph 18, where we're currently circa £17,000, is that a fixed lease cost, or does it go up incrementally? Because, I mean, based on that figure, you know, we've got to pay another £1.5 million out over the next 90 years.
I mean, that's the annual, that's our contribution on an annual basis. That's what it amounts to. And yeah, it doesn't go up, but it will last for 99 years. Yeah.
Linda.
Thank you, Chair. Following on from that, if we are paying £17,000 per annum to keep this building, which we would have to pay anyway, to Braunton Town Library, are we paying the equivalent to all the other libraries that are out, so that it's a fair and equal playing field?
No, we're not, because the lease is with Braunton Town Council, with those other sites, and the original plan with the local community group, we would then sublet that lease to them, so that they would, in the same way as other community managed libraries, be, you know, sort of paying, you know, sort of running costs. With this, it is that long-standing lease which doesn't exist in other sites, that, as we've said, we would have to pay regardless of what decision we make with the library.
Just to sort of be clear, the lease arrangement isn't dependent on or wholly attributable to the library service. Whether we have a library there or not, we have to pay the lease on the building. So we're not paying £17,000 in order to have a library. The lease is payable whether or not there is a library there. It's payable on the building itself.
David.
Yes, thank you, Chairman. The proposals, the policy to transfer the majority of libraries into the private sector has been an exceedingly good thing and a great success. And many villages, including my own of Countersop, now have a better library service than they had before, and I congratulate everybody involved. There have been very few hiccups in the system. Sadly, this is one of them. And I would like to see it go ahead. Braunton is the largest settlement within the Blaby District Council area. There is a need for a library. We can provide it. We can help to maintain it. This lease on the library, or the library building, is unusual, but it exists. And I don't know how it came into being, but it is there, and we've got to pay it anyway. So my suggestion is that we support the proposals before us as the best alternative. The fact that we're not paying every other library this amount, well, they didn't take out or have the same conditions on the lease. But this has been a great success story, and it's far better than ever I thought it would be, quite frankly. When it was first mentioned, I had reservations, but I've been proven wrong. And we do have an opportunity here to do something for Braunton, and I'm fully supportive of the proposals. Thank you, Chair.
Paul.
Yeah, I'm supportive of option 2, but could I have some reassurance that the council would think very carefully about entering into a lease of 99 years? And that wouldn't happen again, would it?
Well, clearly, there may well be some lessons to be learnt. I'm not aware of the circumstances around when the lease was actually signed. It's not within the Adults and Communities Department's area of expertise to advise the council on lease arrangements. We would have to talk to colleagues in other areas of the council, but we could certainly pass that question on. I guess it depends on the individual circumstances that are around at the time and the negotiations that are taking place at the time and the specific circumstances. But certainly we were not involved in any of those arrangements.
Linda.
Thank you. Can I just clarify that I am not against Braunston Town becoming having this arrangement. I was purely saying that if they had a bit of an advantage compared to others, was there anything put in place for others? That was all. I acknowledge it's for the lease and not for running a library, it's for the building. It was purely the fact that obviously they're getting something the others aren't not. I'm not saying that they shouldn't have it, but, you know, it's there, and I wanted it noted, the fact that they are actually getting a bit more than others are. That was all. Thank you.
Question from me then. In view of the fact we've established it's one of the busiest and the issues we got with the lease, why do we not keep this as one of our own libraries which we run, because that then gives us flexibility in, say, 10 years' time, depending on where libraries go for looking at different things, whereas it seems to me if we do this, we're tying our hands for. So how long are we going to ask them to run it for? So how long is the management agreement for? Is it for the remainder of the 99 years? And just on a devil's advocate basis, on best value for the council, have we looked at what we could potentially sublet that area for in terms of revenue income for this council?
Just on the question of why isn't it part of the council-funded network? When we did the work going back to 2014 now, we did an analysis of the usage of libraries and of the 36 that we took this offer out to and consulted on. Braunston Town was one of the busiest and remains one of the busiest of the what we would call smaller library sites. There's still, though, a substantial gap between that and, if you like, the lowest performing network site of the libraries that we continue to fund, which is Glenfield. So there was still quite a considerable gap in terms of usage and what have you. Amongst that grouping of community managed libraries, Braunston Town is the busiest, or one of the busiest. We will need to obviously, sort of look at that in terms of anything that happens in the future. And we need to sort of give some careful thought about the processes that we go through. Should we get to a point if a community finds that it's struggling with sort of sustaining the library, but we're not there yet, and it is something that I guess we'll be writing some reports on and agreeing a process to take on board any eventualities that might happen in future.
Sorry to come back, Nigel. So how long are we intending to give a running agreement to Braunston Town for? Because I can't see that in the report anywhere.
I think if we get the approval on Friday, then that will be the subject of sort of negotiations between ourselves and Braunston Town Council. We've got not to that level of detail yet, but obviously it's something that we'll be picking up of in terms of reviewing, sort of after a period of time.
And will that come back to this committee to review? And also the second part of the question, what other alternative uses could we find for it on a sublease basis that may actually not only cover the cost of the 17,000 a year, but may actually generate an income to this council?
Sorry.
I suppose the answer to that question is, or rather the question itself would only be asked if we decided that we were not going to run a library. So the first, as part of the whole process around the transfer of the libraries to community ownership, the process that we've undertaken is that we've asked for expressions of interest to operate the libraries and to run the libraries. And only where we've not had an expression of interest that we have deemed to be appropriate and that meets our requirements, would we then seek to look at what other options might be instead of the library itself. because our first and our foremost ambition is to ensure that we retain as many libraries as we possibly can. And you know, we have lost one in this process, which is regrettable. But wherever we can, we would seek to support the local communities to run a library. If they could not run the library, we would then ask the question, what else can we use this building for, in order that we either get some income in terms of subletting, or that we use the building for a purpose for which the county council has a use. But at the moment, it's a library service, and we want to retain a library service.
And I just would add to that as well, whatever that, you know, should we get to that point, it would still require the agreement of the landlord, which is the town council, and they're very supportive of, you know, maintaining the library there.
I don't disagree with maintaining the library, etc. What I'm asking is, I don't think this one meets the original criteria we set out, which was to remove the costs off the books. And therefore, I appreciate this committee have looked at it from a library perspective, but the flaw in this one is it should have been looked at in context with assets in the cost of the building and the ongoing lease. And therefore, it's that question that we are actually, you know, we have an agreement to pay out some, well, 1.45 million, whatever it is, over the next 86 years. And it's then the question of, is that a good use of county council's money for that period, which is why I asked about how long the original provision would be with Braunston Town, because who knows what a library service might look like in 15 years' time, for instance. And I wouldn't want us to do another 80-odd year agreement when it may take away some flexibility for us. Right, well, there you go. A nice early evening. Thank you all for your contribution inputs. Hold on, I've got a date here somewhere. The date of the next meeting is scheduled to take place on the 5th of June, unlike David telling you on the 4th at 2 o'clock.